I think we have really rich kind of information that for all of us to digest, and then I would like to open the floor to questions, and if the audience and even the panelists have questions to each other, it's a time to raise your kind of concern, even comments. You know, we like all the ideas, whether it's challenging or supplements or whatever. So yes, we have one.
Okay, thank you. Christoph Eiden from the German Federal Office for Agriculture and Food. And thank you, first of all, to Jiangming Fang. So Christoph Eiden from the German Federal Office for Agriculture and Food, and thanks to Jiangming Fang for having raised again the question of the definition of a food-borne disease. When we in Europe think about global shocks to public health, perhaps with the hotspots in Southeast Asia, we are thinking of avian flu. We are thinking of this kind of zoonotic disease, of pandemics which arrive in Europe. And therefore, this disease frightens us. So, and therefore, it is an issue, and Imon made the case as well. So if you, within the Asian countries, come to free trade agreements with mutual recognition of acceptance of food, yeah, then your situation will be the same like ours in the European Union. And then I think it's quite important to have strong food safety regulations. But then again, I come to this point of linking communities. As avian flu frightens us, so we in my office, we are hosting an avian flu database of the global initiative of sharing all influenza data. So we do this because it's an issue in Europe. So there you have the community of human medicine and veterinary medicine who feed into a database which seems to be rather up to date, as the WHO relies heavily on these data for its vaccine programs. And I'm simply wondering whether it would be useful to link up with these groups in order to learn more where the virus develops, it changes, in order to get some idea where perhaps other problems, the problems lie in concrete terms, and how then politics in improving food safety standards, having better hygiene situations in informal markets might be taken up. So simply ask these researchers in order to get perhaps some more knowledge for your own programs in the other field of improving agricultural policy, of improving food safety standards in your concrete situation. And therefore that might be an idea of how and where one should really interlink with other groups of scientists in order to get ideas for public, for policy to be done with sufficient evidence. At least the evidence is there for the risk for public and animal health. Thank you.
Thank you very much. I think that's a very good point. Yes. Others, we could have questions addressed to specific panelists or just general, so we're going to get the response from them later. Yes, please.
Rainer von Milensky, also from Germany, from BASF, the chemical company. I have a more general question. I liked the definition of evidence. However, my experience is that debates on evidence are often distorted by political considerations or by media impact. I don't want to abuse the GM debate on genetic modification, but despite there's no evidence, be it experimental or contextual, about certain foodborne disease through GM, it hasn't been possible to regulate that on evidence in Europe. And according also to my information, even in your country, Jiangming, there are no food products GM produced. So what would be your answer? How can we deal more intelligently with media bias, political bias, and evidence. I don't have the answer. It's a real big problem, I think.
Thank you. Yes, we have one here.
Hello, I'm Robin from the University of Sydney, and firstly I have a comment, and it's the first time for our colleague from Fiji that I've heard non-communicable disease and bad food being linked as a food-borne disease. I think you're right, and I think it's how it needs to be sold, because it's very hard sometimes to get that message across. I think that's fantastic. My other comment is that I think one of the things that maybe this conference can do around the more classical foodborne disease, such as avian influenza, is encouraging governments and donors to take that landscape approach. One of the big problems that you know very well from Indonesia, from Vietnam, a lot of the donors went in and only wanted to focus on avian influenza. They didn't understand the system that was causing it. They didn't understand the problems that farmers faced, and they certainly didn't understand the multiplicity of languages that where people have their own ideas about disease and what disease is called. So I think the landscape approach can really help those people that really mean well to better understand how they can be more effective with the support. So I'd welcome your comments on that, because I was just an observer in that process. Thank you.
Thank you. Yes, we're here.
Thank you. John McDermott from IFPRI, and I'm the director of the Agriculture for Nutrition and Health program. I have a comment and a question across for all of you. So the comment is, Amor and I, this is not unique to Thailand, this situation of multiplying agencies when the agencies don't perform on food safety. It's very common. In the countries where there's good performance in food safety, they have one agency, and it's usually quite independent from other stakeholders. So that's a comment, or an observation, I guess. My question is, and so we've talked about communities on one hand, and then in some countries, China is one, there's quite sophisticated kind of commercial food systems. So the way those are operated, and probably the way that you need to think about food safety in them, is quite different between those two systems. How do you see in your own countries approaches to looking at developing food systems in more local markets and the food safety aspects there? What do you think needs to be done? In our experience, it's much more about capacity building and incentives and managing diverse risks than it is about regulation. And then on the other hand, when you have commercial food systems, it's much more the approach about regulations and good diagnostics and good procedures and things like that. So your observations on how it works in your own places and some of the challenges, I think, would be quite useful.
Yeah, good. We'll have a lady. Another lady.
Yeah, I know. Yes, so for the food security and for the APEC and for the Asia Plus 3, we have the platform, and also has some framework for the food security, and is especially for the food security in Asia Plus 3, we have the rice reserve. So for the food safety, and I think as the Fiji is in the APEC and other most of the countries in the Asia Plus 3. So I'm wondering with the more people and goods transfer, if there has a similar framework and for the food safety, just like the food, for the food safety, just like the food security. Thank you.
Thank you. If no question from the audience, I want to take the liberty to ask a couple of questions to our panelists before I let you respond. I think first I wanted to get, because Augustine, you talked about really, and I think it's others were talking about how, the key is how to transfer knowledge from all levels, like from researchers and to policymakers, others, to the ground level, which community. I think you had experiences, but you didn't really share with us. Could you give us a kind of how? Because we need to get those concrete kind of a how type of thing in order to move forward. Because I think this is a challenge. It's even we're talking about how to transform our research results into a policy language, but now it's how to transfer the knowledge to the local level. So I think you used the farmer training and schools. During our break, you talked about that. I didn't get it from your presentation here. I would like to hear that.
Food contamination, infection in the food? I don't think so. So who should bring this message to the farmers? I think it's the scientists, the research, the policymakers with their structures should bring this message to the farmers, that the produce that they produce will cause contamination, infection, and other causes that could cause borne diseases. So that's why I think that it will be important if the external the external sectors interfere the community, the farmers, in such a way to raise their awareness that the produce that they produce will be harmful for humankind. That is very important. And in what way we could do these actions? So we do consultation with the farmers on the ground. Listen to them, and then we will get the information. We will get the data, and how they practice their everyday production system. Then we will understand how we interfere them, or how we approach them to improve their ability to save the food that they produce. I think that is the things that are very important. So to transfer the knowledge to the farmers, and to make them understand, to make them aware that they will cause the problems of humankind because of their works. That is my first question. So we do consultation with our groups, and when we don't understand to their problems, then we invite our partners, research centers. We invite people from the university, and sometimes we invite people from the governments to enrich our information to our groups. So that kind of things sometimes make them understand to what they are doing. Your questions about evidence about GMO. Is it a food-borne disease, GMO? I don't know, because in the case of Indonesia, we eat GMOs. I learned from the statistic that we eat almost 600,000 tons a year soybean that we are imported from the United States. We eat in the form of tofu and our other food, tempe, maybe you know it. So I'm finished? Okay.
Not unprocessed, by eggplant.
We don't eat. We don't have that kind of GMOs in Indonesia, but we eat GMOs from soybean and corn. But it should be a science-based. So I think the scientists should have research whether is it harmful or not harmful for humankind. But we are farmers, we don't know it. So thank you.